Good evening, everyone. Thank you so much for being here. I know that for some of you, this is your bedtime, so I really appreciate that you're here. It's my pleasure to present to you today our study, Questioning the Legitimacy of Bariatric Surgery, a qualitative analysis of individuals from the community who qualify for bariatric surgery. I'm currently a PGY3 at Yale, and since I just finished my research time at University of Michigan and was funded through the Veterans Affairs of Ann Arbor, I do have to say that the study findings today do not reflect the views of the United States government. Currently, less than 1% of individuals who qualify for bariatric surgery undergo it, and prior studies have attempted to understand why there's such little utilization of surgery. These studies have focused mostly on patients who are either already being taken care of in primary care settings for obesity and obesity-related conditions, or who are already in the process of getting worked up for bariatric surgery. Few studies have gone into the community to understand how individuals who are not already connected to the healthcare system for bariatric surgery understand it, and whether or not they even know about bariatric surgery. Additionally, the majority of our bariatric patients currently are white women, and so another aim of our study was to recruit a racially diverse cohort. And thus we sought to understand how community members understand bariatric surgery to see if there are potential barriers that we can address. In order to reach out to the community, we had a community partner within the Western Wayne Family Health Centers. It is an organization that serves a predominantly Black community in Michigan, and in addition to providing primary care, also provides other social services to the community. With our community partner, we then developed our interview guide as well as our outreach flyers, and we posted these at the local health center as well as food establishments, libraries, stores, and nail salons within the community. Individuals then reached out to our study office, and we conducted semi-structured interviews of individuals who had not yet undergone the workup for bariatric surgery, but who did meet the NIH criteria. These interviews were then transcribed, and we used an exploratory iterative method to code the transcripts. 2 team members first independently coded 4 of the interviews to look for patterns, and then the team met together to discuss where the codes were converging and diverging to create a final coding scheme. And in the findings that we present today, we'll be presenting the findings from 2 codes, legitimacy and trusted sources. Throughout our study, we recruited 32 participants with interviews that lasted between 35 to 90 minutes, and we were able to recruit a racially diverse cohort and one that was varied as well in insurance status. There were 3 main themes that emerged from our analysis regarding how questioning the legitimacy of bariatric surgery was a major barrier for a lot of these participants in considering bariatric surgery for themselves. The first theme is quack science for profit. Bariatric surgery was seen as a commodity or a service that was purchased rather than legitimate medical treatment, and participants equated bariatric surgery with things like botulism of the lips and other examples that are given here. One of our participants, Adrian, stated, "I have similar views when it comes to laser surgery to treat vision problems, and I think, oh, they're going through these weird things that may not be real hospitals, and it seems profit-driven. They're centers, which doesn't give me that warm confidence that it's my doctor's practice." And another participant, Sandra, noted that, "I know at one time when bariatric surgery first came out, there was a controversy on where your insurance would pay for it, because I guess they said if it was for cosmetic purposes, your insurance wasn't going to pay for it, so I don't know how it is now." Thus, bariatric surgery was seen as outside of mainstream medicine for the majority of our participants and grouped with other cosmetic or remedies that may not be real. As one participant put it, a quack science. A second theme that emerged from our analysis was that bariatric surgery seemed illegitimate because people had not heard about it from doctors. As one participant put it, "Why has my doctor never mentioned it? If bariatric surgery was a legitimate therapy, they would be recommending it." As Vicky says to us, "I'm also treated for obesity, but my doctors haven't referred me anywhere for obesity. I don't know how trusting they are of these things because they've never referred me anywhere else for obesity. None of them have. But they've mentioned obesity, but they've never treated me like giving me a referral to a bariatric surgeon." And we found that participants whose doctors had mentioned bariatric surgery before, talked to them about it, were more likely to see it as legitimate medical therapy. And for these participants, they were able to link bariatric surgery with positive effects on their health. As this participant, Latoria, shares with us, she was able to see how bariatric surgery could help her with her diabetes. The third theme for why bariatric surgery did not seem legitimate was because there was seemingly conflicting information about pre-surgical and post-surgical weight loss and diet for these participants. For pre-surgical weight loss, it was confusing to them why they would need to lose weight prior to getting a treatment that was also supposed to help them lose weight. As Paulina noted after watching the show, My 600-Pound Life, they want you to lose a certain amount of weight before you can get it going and all that. And I feel like if I'm going to do that, I might as well just keep losing the weight. Why even go do the surgery? And regarding changes postoperatively, some participants were confused about all the warnings that they saw on television or advertisement, or had heard from their colleagues or friends who had gotten bariatric surgery about the possibility of weight gain afterwards. To them, they connected that to overeating, which was confusing because it seemed like you had such small stomach left. They didn't know how that could be possible. So in summary, we're able to find these 3 themes related to how participants questioned the legitimacy of bariatric surgery as a medical therapy, which then prevented them from thinking about bariatric surgery for themselves. Some strategies to address these questions of legitimacy may be to include more physicians in outreach materials, since we found that doctors were trusted sources of medical information. Additionally, calling bariatric surgery clinics centers may actually have a negative impact on how some people in the community view bariatric surgery. And lastly, more information may need to be put out there about what happens postoperatively, especially about the weight regain, which seem to confuse individuals the most. I want to thank my community partner, the Western Wayne Family Health Centers, as well as my mentor on this project, Dr. Mary Burns, and all of my collaborators who helped make the analysis more rich and clear. Thank you. I'd like to answer any questions.